Hello and welcome to Ask a NACDoc. My name is Jeff Patterson, Nacogdoches Medical Center Chief Executive Officer. And today I have Dr. Nguyen, our Emergency Department Director, and we're going to talk about our trauma levels as well as chest pain and stroke care at Nacogdoches. Welcome today.
Thank you so much for having me, Jeff.
All right, so last year, Nacogdoches Medical Center at both our main hospital and its center saw over 30,000 patients. How do you guys keep up with all that?
We just put on our coats or our stethoscope and we just get it done.
Now, one of the things that differentiates our hospital is having a level 4 trauma designation. Can you explain what that means?
So yes, so with a trauma designation, that means that we have a trauma surgeon on call 24 hours. We have neurosurgery as well as orthopedics on call 24 hours for to take care of all your trauma needs.
And usually that's what kind of accidents or what kind of things do you see coming in for trauma?
So in our Nacogdoches and surrounding areas, we see quite a bit of a motor vehicle accident, so please be safe when you're driving. But we also see farm injuries. Once in a while we see gunshot wounds, so I'm glad that's not very frequent here, but we're definitely here to take care of your trauma, especially if they're from the ER, being discharged from the ER, or being discharged from the hospital. So I think that helps a lot.
Mm-hmm. And then chest pain as well, folks having symptoms of heart attack, etc. What are some of the processes and protocols we have in place to help treat people's chest pain?
Right, so and you're having chest pain, you come to the ER, you're definitely moved up into the queue. We see you as soon as possible. We room you, we obtain EKGs, blood work, check to see if you are actually having a heart attack, and if you are, we act very quickly, or we have 24-hour cardiologists here to help.
When it comes to stroke care, what are some things that the general public should keep in mind when seeking care?
With stroke, time is brain, so definitely want to seek care as soon as you have any of the symptoms. And one of the acronyms that can help you remember something called B FAST. So B stands for balancing issues. So if you have trouble walking, E stands for any kind of visual disturbance. If you lose certain problems seeing with your vision, one part of the field is gone. The other part of it is fast. F meaning facial asymmetry. If you see someone with a droop on their face, A means arms. So if they're seeing any kind of weakness of one arm compared to the other, S means speech. So slurring of speech, or if they have trouble getting certain words out, and T is time. So definitely want to seek care. And the golden rule is you have to be, well, as soon as possible, but must be within 4.5 hours.
That's great. I think it's going to be really helpful for a lot of folks if they experience those symptoms. What do you like most about being medical director of an emergency department?
Well, I really enjoy as far as working with everybody in the hospital. As the emergency medical director, I work closely with administrators, great like Jeff here, as well as all our physicians, our specialties here. So I think that's probably the best part of my job.
No, it's super rewarding, and we're very lucky to have you as our medical director. Thank you, Dr. Nguyen. And thanks everybody for joining us again for Ask a NACDoc.